Hi everyone, I'm very excited to be moderating this fireside chat with Kathleen McGrow and Steve Shahada as they reflect on the past year of massive disruption and forward strides in the healthcare industry. Kathleen's career has spanned the University of Maryland Trauma Unit to healthcare digital transformation at Microsoft, where she is currently the Chief Nursing Informatics Officer and Industry Executive at Microsoft Health and Life Sciences. Kathleen holds a Doctor of Nursing practice and uses that every day in her work with Microsoft clients. Steve has been the Chief Commercial Officer of several health tech leaders and is the CEO of Get to Market Health, a specialized consultancy focused exclusively on accelerating sales and driving revenue growth for healthcare technology clients. Steve has spent his career in healthcare and has had the good fortune of working with Kathleen at multiple companies. Welcome, Steve and Kathleen.
Hi, Claire. Thanks for having us.
Hey, Claire. Hey, Kathleen. Great to be here. Nice to catch up with my old friend Kathleen and to be in this fireside chat.
So in the summer of 2020, Get to Market Health posted a blog with predictions on how the pandemic would impact the US health system. We thought it would be interesting to reflect on how we did and, more importantly, discuss the key trends that we see going forward. Let's look at the list and see what some of the hits and misses are.
So it's pretty fun, Kathleen, to look back sometimes and see what you did and see what what we thought and where the world has gone. But when we looked at these the market back in July, because clients were asking us about it, I know you were getting it too at Microsoft, is what do we think the big changes will be? And maybe what we can do is sort of focus on the things that came true.
Sure, I'd love to do that, Steve. I think you were pretty on the money with some of these, actually.
Yeah, these five are great, and if you hit 500, they probably put you in the Baseball Hall of Fame. But we're trying to get in the Healthcare Hall of Fame.
I agree. I totally agree. Do you want to go through these and talk about them a little bit?
Yeah, let's do it.
All right, awesome. So I'm interested about the greater acceptance of telehealth. As you know, Microsoft was very engaged early on in the pandemic. We're a global company. We had peers that were impacted in China, and then with the first cases identified in Washington State, where our headquarters is located, we very quickly needed to deploy our employees to work from home as that strategy. And that work from home response really then moved to how do we help our customers, having much of their workforce also working from home. Then we saw the need for telehealth and communication for patients in isolation, both for providers to protect doctors and nurses and also to protect patients' families. And that was really related to both isolation safety as well as PPE resources being strained, personal protective equipment. We worked really quickly with our healthcare organizations to deploy our Microsoft Teams. We had one customer that actually deployed 39,000 users on Teams over a weekend. I think that was back in April of 2020 when things were really moving very quickly. We also work with clinicians to understand the needs and the workflows, and we had to be really fluid. So we were able to access our team's engineering group where we were able to be agile and deploy more quickly and have this rapid feedback loop. So based on what our customers' requests were. So since we support so many different verticals, this was also happening, as you know, in financial services and education. We saw a lot of children having to do school from home, as well as our retail organizations being redeployed since they weren't opening up. So for sure, the pandemic expedited these features and functionality. And we also announced our Microsoft Cloud for Healthcare, and we rolled out those tools that really let patients work to be able to self-schedule virtual visits, in-person appointments through their existing patients portal. So I think that we see that telehealth has definitely expanded. There's greater acceptance, and I think we're going to see it moving forward. I don't know if it'll sustain at the height that it had been, but I definitely think it will sustain and it will be ever moving forward within healthcare.
Yeah, it's like telehealth finally had its day after 15 years of being about to have its day. And it was really, really great to see. And like you, I think it's here to stay and, will maybe take different shape, but here to stay. I mean, it's actually one of the examples of expanded covered services because the government quickly moved to implement reimbursement for telehealth visits, which they hadn't really consistently done before. Certainly, they reached out, covered vaccines and other things. And so I think, the first two, kind of clear as day happened. The third one, I think it's really interesting. The CFO for years has struggled to rein in his or her rogue physicians and rogue hospitals. And I think the pandemic gave the CFO more power, more control than he or she has ever had before. We saw that in many places where they eliminated choice locally and implemented severe cost controls. So, another one that really happened quickly.
Yep, totally agree. Will say that I'll just add, I've been speaking with a lot of CIOs, and they were saying they're working more closely with COOs and CFOs than ever before.
Yeah, for sure. The command centers, pre-pandemic were kind of a leadership thing. Places like Hopkins, Hartford Health, Humboldt River up in Canada were the sort of the first places to have official command centers. Today, everyone has one. Now, it may just be a conference room, but everyone has a command center. We had the good fortune to work with a client or two in the space who was helping light up communication among command centers. And so we got to see it firsthand. It was clearly, something that, came about and got really emphasized due to the pandemic.
Yeah, I totally agree. I also spoke with customers. They were actually leveraging Microsoft Teams, which is what we're using to record today, to manage their command centers. And they said that ability to be able to have instant, IMing as well as telecommunications was really helpful for them within the actual command centers. And then we also had other types of command centers that were deploying AI, say, for example, the GI Mural virtual care solution. So that was kind of a command center that was virtual care driven around patients that were in critical care areas. So you could monitor all their vital signs as well as their ventilators and all their other equipment. It kind of gave a comprehensive view of the patient status around that care area. And these were actually being deployed in the medical the field facilities, right? So there were these stand-up hospitals at like the Javits Center in New York City and some other places, and they were able to leverage that technology because essentially you're in a convention center and you're trying to run a hospital. So they needed that type of ability to be able to monitor those patients.
Yeah. The fifth point here around supply chain, we all got to see firsthand the challenges of working a global supply chain, and even on a localized basis, hospitals and health systems really struggled on. So it got a lot of focus, and part of that, is tough because there were some problems, but there are also some successes there. I think you all had some experience in this area.
Yes, for sure. So customers were reaching out for us very early on in the pandemic because they really were looking for process automation around supply chain because they didn't have enough PPE. They didn't know where to find PPE. They wanted to be able to manage the equipment they had, such as ventilator management. This was all being done as a manual process on Excel spreadsheets. So really labor intensive and cumbersome. So process automation for supply chain management was required to manage the insight and visibility into their supplies that the organizations either had or required. So we had one customer with which I think had about 12 hospitals within their hospital system. They were overwhelmed with COVID-19 patients at a handful of those hospitals, and they were not able to even look across their system at the local hospitals to see if they had the supplies that they needed. So instead of going to maybe a neighboring hospital that was more local, they actually had to do online searches for suppliers and essentially felt they were overpaying for PPE. Because as you remember, when masks and gloves and gowns were really at the peak of need back in that springtime with all the surges, initially people were really, I would say suppliers were kind of like increasing the price, right? It's supply and demand. And so they were paying a premium for supplies that they later found out, oh, if they had just gone to another hospital in their organizational grouping, they would have been able to have those supplies. So automation here, I think would have really been helpful for them from the get-go.
Yeah, for sure. Claire, maybe we go to the next slide. These are the things that we sort of think are still a work in progress, if you will. On the first one, bring care to patients, I think it's an obvious area where there's tons of development going on. We have a client today that is bringing powerful imaging technology in multiple modalities to the patient bedside in ways that it could never before. And I think that there are other avenues for bringing care to patients or bringing it close to them. I'll let you comment on that, Kathleen.
Yeah, absolutely. We work with multiple customers that actually during the pandemic, they really were trying to figure out how to manage their patients in, less risky areas. And so sending them home earlier was really the best methodology for that. So there was two reasons. They were trying to keep the beds available for the sickest of patients, and they were trying to decrease the transmission of communicable diseases. So I think now organizations, they've proven this can work. So we're going to see more and more that patients can be managed in their homes. There are a few sticking points that we'll need to overcome. One is the need to be able to have a proven model that's very effective to be able to improve patient outcomes, right? 'Cause it's all about making sure patients are getting adequate care. Then we're going to need to see if there's an acceptance of the models by both the providers and the patients. And we'll need to continue to push for telehealth reimbursement to ensure that regulators understand the value of telehealth, both in patient outcomes and in the provider experience, and the value and the savings that can be rendered. I think that we also need to look at consistent laws across states today, because there's some regulatory complexities and there's some barriers that are created because of that. But I totally agree. Bringing care to patients in their homes is really the way forward.
Yeah, I think hospital at home or home as hospital is going to be a thing we'll hear a lot more about. Maybe we can talk about it a little bit later too. The next two, CMS and state mandates, we certainly saw lots of noise from both CMS and the states. I don't mean noise in a negative way, but activity around mandates. And I think what we've seen is we sort of have 50 states or 50 states in a district all doing things a little differently. So we think that yeah, we were probably a little optimistic that this would be consistent and applied in a standardized way than it actually did play out.
Yeah, I agree. I wish we had better consistency. Maryland has a great model. Maryland state model, I think, is a great model because we actually follow the model for trauma care in the state. So patients were taken to the hospital that had the care that would be able to be provided, that level of care. So if you were in an outlying hospital, they would transfer you to a hospital perhaps at a large university medical center that had that capability. So I think that and that model was very clearly defined from the level of the governor when it first started. And I think because residents of the state of Maryland are very in tune to our trauma system, which is a level trauma system, that when it was explained that way, that they understood it, and no one really was concerned about that. So they weren't worried they would end up in a hospital farther away from where they lived if they were less sick, and vice versa. So I agree. It'll be interesting to follow this one farther, Steve. We should look back at this one in a couple of months or in a couple of years and see where it goes.
Yeah, I think for sure. Um, so let's talk about the big getting bigger.
Absolutely. I saw a few M&As that looked like they were going to happen, and they actually did. I was kind of surprised just because of the unknowingness around the fiscal relationships within organizations. But then I also saw a few health systems and health plans continue to merge, which also I thought was kind of surprising, given that we had this kind of unstable financial situation going on. And then I actually saw a couple of them not go through. So they actually fractured and they never occurred. And I think there was about three that were on our radar that I was aware of, and it never occurred. For one reason or another. I really don't think that's uncommon. I just think that it was notable because it happened to be COVID at the time too.
Yeah, I think it's been an unsettling year, and there's still a lot to shake out. But I would say that we've seen actually fairly recently. Last month, the Washington Post published a big article on how places as diverse as UPMC, Baylor Scott and White, Mayo, Advent Health, Intermountain, some really big brands uh, really had a very strong year financially during the pandemic, and that wasn't seen by the small organizations out there. So I think there's still more to play out in this area. And finally, let's talk about increasing pressure to reduce variation among hospitals.
Yep. So clinical and operational variation, I hear about that all the time because I mostly am talking to clinicians, and they're very keyed into that. That variation really goes a long way to improving patient care. And for most organizations, really, that's what it's all about. So I speak with clinicians all the time that talk about reducing clinical variation and how can we do that? And usually it comes down to automation and artificial intelligence being able to help. I'll give you actually one example, the Nuance Dragon Ambient Experience, or DAX. It was innovated by Nuance, and it has Microsoft technologies that are at the underpinnings, and it really promotes a better patient experience by accurately capturing and automating documentation for the provider. And it actually allows the physician to give more attention to the patient. That's really ultimately the idea there. And the process automation really helps the provider be more efficient. They have the ability to go in and make edits and changes if they require based on the transcription, but it really allows them to adhere to care standards and practices, whether that's across one organization, one hospital organization, or a broader standard, whether a state or even a regional. So I think that that's one technology that I can think of that really will help with that. Variation really is detrimental to patient care and to organizations.
Yeah, it's super interesting. This past week, an article came out about how Providence Health in Renton, Washington, sort of one of the larger, more prestigious systems in the country. I think they have 55 hospitals. One of their hospitals is trying to opt out of the system because Providence is introducing such consistent practices, best practices, so that they can reduce variation. So you sort of see both sides of it. Claire, why don't we go to the next slide and just sort of see where we really think the next 12 months will go. We did sit down ahead of time, Kathleen, and talk about what we thought would be the real big rocks facing the healthcare system over the next 12 months. And I'd like to just touch on a couple of them and then sort of turn it to you. First of all, I will put my big bet on bringing care to patients. The idea of moving patients like a slab of meat to some central site that makes sense for the health system probably doesn't make sense for patients anymore. So I think that one is a big one that's going to change. I think as the dust settles around the pandemic, there's no doubt that the big systems, the big health plans are going to get bigger. I mean, there's lots of players in the industry who, on the technology side too, are getting bigger. Certainly, Microsoft is making key investments in healthcare. And we really did talk about variation. I think that's an unstoppable wave that's going to happen. People are going to be, really working hard to reduce variation. And I'll let you comment on the next two.
Sure. Yep. So we work with so many customers that are leveraging artificial intelligence. When we consider and think about AI, it really moves us beyond business intelligence. So it realizes this idea of advanced analytics. I always say it's going from what happened, why did it happen, to what will happen, and how can we make it happen. So essentially, the whole hindsight to insight to foresight. Advanced analytics in health is going to lead to the new paradigms of patient care, including those supporting things like the hospital at home and some others. And it's also going to provide the ability for our providers to care for patients. For example, using EMR data combined with other data to predict patient deterioration, or using EMR data combined with other data to predict how a patient would be able to engage in their health and interact with an organization. I think that the impact of AI is going to be big on healthcare moving forward. I also think that the vaccines to vaccinations, that's an entire workflow and process that is going to continue into the future as we learn from this pandemic and apply those learnings to really prevent future pandemics.
Yeah, clearly vaccines leave some room for improvement in terms of how we deliver and how we accept them. So I agree that for sure. I would just sort of, as you and I kick through the summary here, I would say, first of all, health systems proved way more agile than any of us expected. I remember listening in on a call with Michael Dowling, the CEO at Northwell in New York City and Long Island. And, he said something to the effect like, I'm never going to believe IT again because they stood up a whole hospital in 3 weeks. Hospitals, they proved their mettle during this, health systems and hospitals proved their mettle during this period. Even health plans, were agile in terms of how they thought about reimbursement. And, I think it was actually pretty impressive, and maybe they all did a little better than we thought they would.
I totally agree. Big innovation and forward progress for healthcare. The increase in the pace of progress is unprecedented. And I think that the crisis helped us identify what really matters. The one use case I think was emotional for all of the team that I was working with a customer on connecting isolation patients to family members. It's tough, to talk about really sick patients that are not allowed family to visit, especially when they most need them. So it's satisfying to ensure that, the solution worked and that we were able to connect those patients to their families. It was just that in itself, I think, was worth it.
Yeah, so I really couldn't agree more. Patients matter, taking care of providers matters, the overall health matters, and improving the healthcare system matters. And I think we're all really focused on that. I'm reminded of a Chinese proverb where they talk about, in the same sort of word structure, both danger and opportunity. And in a crisis, while there's plenty of danger, there's also opportunity. And we really saw health systems and all parts of the healthcare ecosystem, technology providers, health plans, and patients really work towards the opportunity and improve and be more agile. So pretty exciting year to be in healthcare, but probably not as exciting as the next year. So Kathleen, I just want to thank you for having us today. It really was fun, not only personally to catch up with you, but to talk about these big issues.
Steve, it was great talking to you. I think it'll be really interesting to see what happens over the next 6 to 12 months. So let's look at syncing back up then and having another fireside chat, keeping people up to date.
That sounds great.
Great. Well, thank you so much, Steve and Kathleen. I'm really looking forward to the next fireside chat with both of you.